The honourable member for Clare Digby.
Thank you, Madam Speaker. And I'd like to also, I could almost use a doctor here today. I do have a family doctor, by the way. But I would like to thank the opposition for bringing this forward. And also encouraged to hear the members opposite speak, especially the previous Minister of Health. And I want to say that this isn't a new problem. I really, I'm a bit surprised in a way that we're framing it sort of as a new problem. But this is something that's been going on for a long time. And I'd like to also state right off the bat that 2 years ago we did commit to providing a family doctor for every Nova Scotian. And I firmly believe with the hard work of our minister that we will succeed and we will achieve that goal. It isn't going to happen tomorrow. There's a lot of moving parts to this. And just to start off with, I'd like to also note that, as everybody probably knows, we have more doctors per capita than any other province in Canada. We have more disappropriated doctors in rural Nova Scotia than anywhere else also. And also, we spend more on health care per person than any other province. So there's something definitely wrong when you have more doctors and you spend more money and you still have an acuity and you still have some of the worst health indicators in the country. We have some of the worst problems with youth and diabetes and obesity. We have an aging demographics, and the problems are only going to get worse. So there's something wrong with the system, and it wasn't too long ago, actually it was April 1st of this year, that I believe we started charting our path towards fixing what we have as a very broken healthcare system. So let's just start by framing it that way. It was interesting to hear the comments from across the floor. There was a lot of things that certainly were not pointed out, and they've asked me to, and I take great pleasure in pointing out what we've started and put in place. What wasn't mentioned right off the bat was the fact that in January of 2014, we appointed a physician recruitment and retention team, first time in the province. That in itself speaks to what we're going to try and do in this province, what we are going to do in this province. Recruitment, I'd like to also speak briefly on, is I would look at it from my experience as more of an art than a science. Certainly it's more than just a simple appointing of a group of people to do something. My time goes back 8 years before I was elected, when I was with the municipality of Digby, and I saw a municipal unit struggle with incentive programs. I saw a municipal unit struggle with a committee that was doing doctor recruiting. They hired recruiters. And for 8 years, we're going back 10 years ago now. So again, this isn't a new problem. For 8 years, I saw a municipal unit compete against other municipal units and virtually not get an awful lot of support from the province. And I lived that firsthand. I watched and I saw all the municipal councillors actually even question themselves, was it their responsibility as municipal government to do that? And I still think we see that going on. So the fact that we have a recruitment and retention action team, I think, is a big step. Also in January 2015, I'm very, very proud of the fact that our government announced a new tuition relief program. That will pay $120,000 in tuition for new medical graduates. There is an excellent step towards fixing the problem. Young doctors relocating from outside the province will work in underserved communities for 5 years. To add to that, if these doctors are outside of a community without a regional hospital, they receive an additional $30,000. Now, I hope that some people are understanding that these are incentives. These are things to try and fix the problem that I'm very proud that our government has brought forward. These are going to serve areas that are outside of Bridgewater, Yarmouth, Kentville, Truro, Amherst, New Glasgow, Antigonish, and Sydney. So those areas, doctors get an extra $30,000 because we know that rural Nova Scotia is underserviced. This will also help encourage new physicians just starting out to set down roots in small communities that need them the most. Great success through our rural residencies program in southwest Nova Scotia and the Annapolis Valley are also good examples. These sites allow medical residents to experience a lifestyle that may not be otherwise imagined. But today's young physicians want to practice differently, and I think everybody understands that. They want not to be the old small-town rural doctors of generations ago. I have a good example of one of those in my riding, a Dr. Westby, just retired. He was still doing house calls, if you can imagine that. So they want to know that they're working with a team. That's why I'm extremely proud also to note that this government, and I'm going to give some credit to the previous government, that invested $600,000 in a health clinic in my riding. Now, I must say that they weren't the principal shareholder in that. The Health Foundation there, they provided, I believe, $1.6 million towards that project. So if it wasn't for that Health Foundation, that would not have happened. Now, in saying that, I'd like to note that I'm also very proud that what was done in Digby was also done in Shelburne by our government, not by the previous government, by our government. And that we announced $1.65 million towards a new medical facility in Shelburne that was previously ignored by the previous government. And I'm very proud that our minister went down there and showed that community that we're committed to collaborative health care in the province of Nova Scotia. These collaborative healthcare centres don't simply just have a family doctor. They'll have access to professional health care, people such as nurse practitioners, family practice nurses, dietitians, physiotherapists, and anybody else that the community might need. This type of practice helps make practicing in a small community more attractive to new physicians who knew they weren't going to be able to work when their patients weren't covered. It also means better care for Nova Scotians. Another important step that we have taken is to update the provincial nursing strategy and to align the nursing education across the province. You failed to mention that one also.
Order, please. Order, please. The honourable member for Clare Digby has the floor.
Under our new strategy, we will devote funds to allow experienced nurses time to mentor new nurses. We will increase the number of specialty programs to train nurses in areas where they're needed, in areas like operating rooms, critical care, and mental health and addictions. We will target co-op placement funding for student nurses to go to geographic areas where they're most needed. It's also too important to note that we've amended the Hospital Act to allow nurse practitioners to discharge patients from hospitals. These amendments will also allow registered nurses to access, treat, and release some patients in emergency departments and collaborative emergency health care centres. Nova Scotia Health Authority is now working with sites across the province to make this a reality. It is an important change for everyone. Doctors, nurses, and patients. It means nurses and nurse practitioners will be able to do the work that they have been educated and licensed to do. So, in the final few minutes that I have here, I've outlined very quickly, 10 minutes doesn't do it justice, a lot of key things that this government have brought forward. And in 6 months, these people across the floor expect us to turn around the numbers that we have of doctors in this province in 6 months. I don't know where that magic wand came from, Madam Speaker, but I think what we have done here in 6 months is more than the combined efforts that I've seen from the previous governments in the last 10 years. I'd also like to just finish up by thanking the Minister of Health.
Order, please. Order. Order.
Come on now, Gordon. Finish strong.
The honourable member for Clare Digby has the floor.
Thank you. Obviously, these were all points that were missed by the other side of the House. And I would like to say that I have the utmost confidence in one of the most outstanding ministers that we have, the Minister of Health, in his ability to bring forward these changes to our province. Thank you.